This is a scene familiar to most of us. The hallway of a hospital. Clean, well lit, with doorways leading to sanitized rooms and other hallways that resemble this one. Now compare this hallway to the last. Not very similar. Nonetheless, this is a hospital hallway, though this one is in Western Africa, in the country Gambia. Unlike the hospitals most of us are accustomed to, the hospitals you are about to see have unreliable electricity and questionable water. It's hard to imagine being cared for in these type of conditions. There is no brightly lit operating room with running water, just a dark, cold room where often the only light the doctors and nurses have is that given off by candles. Unfortunately, this is a scene repeated in hospitals throughout this poor nation, and serve approximately half the population are forced to go without. Hospital staff and the government of Gambia do what they can to correct the problems they face, but unfortunately are practically powerless due to a lack of funding. With an average income of only $290 a year, private citizens and the government lack the financial resources necessary. Most Gambians are laborers, with the main exports being peanuts, peanut products, cotton, fish, and palm kernels. With income levels being so low, there is not much for the government to tax. This results in government facilities often being those hardest hit by the financial shortfall.
The other parts. Now, imagine a hospital with no lab, no pharmacy, no theater, and the archival table at the outpatient department used to be the table that divided into two parts. Half of it is where the nurses can see patients and diagnose, and the other part is where you have drugs and dressings to take care of the patient. That was all I had.
Some of the challenges that this hospital has is there's no native physicians here. They have to rely on international support, be it volunteers that come from around the world, or they also have Cuban physicians that come here for 2-year contracts. And the problem with the Cuban physicians is they don't speak English, which is the national language here. They also, for periods of time during the year, go back home on holiday. So right now in January, there's no physicians here because all the Cuban physicians have left to go home on their annual leave. So this is a big challenge in the Gambia, particularly at this hospital, where they have long periods of times where there's no physicians here.
Well, my name is Ulrich Jones, and I'm a consultant general surgeon and neurosurgeon. I'm a visiting surgeon to Buyam Hospital on invitation of the administration to assist in future developments of operating theater facilities in the hospital. I come here usually once a week on a Saturday, and I do operations on cases that have been properly programmed and worked up and are fit for surgery and have signed consent for surgery.
So we started building up the hospital, started getting another generator, which can now push out to give 4 hours of electricity, 2 hours in the day and 2 hours at night, at least to encourage the staff and also to enable the staff to be able to do some work at night. But what was more appalling was that if they want to epistomize a patient at the maternity, they do it under candlelight. You have to put up a candle and you have to suture the private parts of a patient.
So any case that comes within that time when the light is off, it is attended to in darkness. Most of the time, either through what we call torch lights, this battery torch lights that we use, and then supported by candle light. which we know is definitely not very sufficient light that is produced.
It was so appalling, so absurd, so discouraging that efficiency and effectiveness was kind of compromised in so many things. And nurses, when they see patients, they find it difficult to get potable water to wash their hands. Such was the situation here.
When it comes to resuscitation also, the newborns, now, sometimes we have difficulties in resuscitating them because the suction machines we have, we are using electricity. And then with those suction machines that uses electricity, when a newborn has asphyxia or difficulty in breathing, or he has some secretions in the mouth, we find it difficult. So what nurses usually do is they use a tube and do what we call mouth-to-mouth suctioning. They just use a tube, put it in the child's mouth or in the nostril, and then try to pull it out, which was not very effective. And as a result, many neonates usually might actually have difficulty in breathing after birth, or might eventually lose their lives.
The deficiency in essential resources required by doctors and other medical professionals make it nearly impossible for them to properly perform necessary procedures. This is undoubtedly one of the underlying causes of Gambia's low birth rate. Gambia has an infant mortality rate of approximately 84 deaths per 1,000 births. This is a clear illustration of why sustainable natural resources need to be brought to the forefront in the healthcare system of Gambia.